A very pleasant evening to everyone present here. We warmly welcome you to all to the third session of THIRAN by IMA MSN and GDN Tirunelveli. We will start the session with IMA prayer by Dr. Thanu Murmu, Council Member of IMA MSN Tirunelveli.
Okay, I think that's a connectivity error. I'll go on with that IMA prayer. So IMA prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and fear. Thank you.
Thank you, ma'am. Next is the precision prayer by Dr. Jayant, co-convener of IMA MSN Tirunelveli.
Good evening, everyone. Physician's prayer. Dear Lord, thou great physician, I kneel before thee. Since every good and perfect gift must come from thee, I pray, give skill to my hands, clear vision to my mind, kindness and sympathy to my heart, give singleness of purpose, strength to life, at least a part of the burden of my suffering fellow men, and a true realization of the rare privileges that is mine. Take from my heart all guile and worldliness, that with simple faith of a child I rely on thee. Thank you.
Thank you, sir. Next, I call Dr. Kirtik Roshan, Finance Secretary of IMA MSN Tirunelveli for the flag salutation.
We, the member of Indian Medical Association, stand here to salute our national flag. Its honor and glory shall be our light and strength, and its course shall be our course. We pledge our allegiance to it and realizing our responsibilities as the accredited members of this national organization. We swear we will dedicate everything in our power to see it fly high in the community of nation. Jai Hind, long live IMA. We invite Dr. Srija ma'am, member of JDN, to give the welcome address.
Okay, thank you, Karthik. So THIRAN has been a wonderful session going on. This is our successful third session in a row. So we are doing it for 3 weeks now. Every Wednesday in the night time 8 to 10, we are focusing on enlightening our aspirants of various medical exams we have individually and who are with the support of the achievers from Tirunelveli Medical College. So we have so many achievers for each and every exams we have after MBBS. So we have done the first session on NEET PG and the second session on MRCP UK, and successfully we are going for the third session on UPSC CMS, which is yet another unexplored exam. So many have the aspiration to successfully complete the exam and join in this field of UPSC CMS. And many have the inspiration from other people who have done the exam and are successfully working. So we have our two wonderful speakers who have completed the exam, and one of them is working for 4 years on this field, and they are proudly our alumni of Tirunelveli Medical College. So I'm pleasure to meet you all in this online event to carry out this wonderful enlightening session on UPSC CMS. I invite everyone for this online session of THIRAN online series for the aspirants from the achievers. So we are proudly presenting this third session on UPSC CMS, and I hope it will be very useful for everyone who are aspiring for UPSC CMS. And we'll in this 1 hour we'll be discussing on every nook and corner about UPSC CMS. So I'm presenting this session on behalf of IMA, MSN, and JDN Tirunelveli. And I also thank our mentors who have supported in every aspect to make this session a wonderful one. So we'll go on to this session now. Thank you. We have our past president of IMA Tirunelveli, Subramanian sir, to open this event. Sir, I invite Dr. Subramanian sir to give a felicitation talk on this session, sir.
Hello, can you hear me?
Yes, sir. Good evening, sir.
Okay. Yeah. Good evening. Good evening. So, it's another week. So, really glad to see the IMA MSN growing this way and arranging this webinar on career guidance. Definitely, it's going to be useful. I have listened to the previous three. This is the fourth one, I guess, right?
This is the third one, sir. First one was
Third one.
Second one,
Okay.
yeah, sir.
Okay. Yeah.
Now it's you.
So, sure. So it's definitely it's a useful one. Of talented people who have already gained to the next level. So I'm happy that this is a good program. Now, today's program, there are two speakers. So both of them have gone into central government health service, CGHS, in different ways. They are going to share their experience and also tips for ticking the box and get into the groove of successful career choice. I'm sure the PG preparation is one that is a foundation, but this is predominantly a job-based approach. So it's because it's going to be a central government job. As of now, it's age 65 until you can continue to work, and you can also get promotion as you grow along. So, in fact, I'm glad to say that one of our rheumatologists who joined the army as a doctor long years ago, he is currently the head of central government health service for the army people. So he is Director General in Delhi, and he is from Bangalore. So similarly, you can be the NMC head at some point, or you can be head of central government scheme at some point, when you are above 40 and 50. So so it's a good post. So try to improve your skills also. The foundation is your PG preparation, and you can do any sort of exam for this. So so similarly, the combined medical services in UPSC, which is the Group 1 service, that also has a similar medical paper. So that will also be briefed on some other day, I hope. And I wish this program a great success, and try to get lots of tips from them, and try to involve more students from other colleges also, because it's teaching வந்து நார்மலா if you continue to teach, it will also infuse your enthusiasm. So that is the way people continue to teach. So this is apart from teaching, yes, you are going to share your expertise to the budding doctors. So all the best, Srija, and all the delegates today, and also the two faculties for today's program. Wonderful. All the best. Thank you.
Thank you, Dr. Subramanian, sir.
Thank you.
We have, thank you, sir. We have our IMA JDN Tamil Nadu chairman, Hariharan sir, also in this meeting, and please our other mentor who has always led us with who's from Chennai to Tirunelveli. He is our link for every events we conduct. And sir, please, I welcome you to share a few words for this event, sir.
Thank you, Dr. Srija. I think IMA Tirunelveli, MSN and JDN are doing a wonderful work with the THIRAN. So it's the third one. I think it's good going. And I would like to hear from you guys about your, I think the experience in UPSC. So, JDN and MSN are there to handhold all the young doctors, both the medical students and the young doctors. So this is yet another platform. I think let us get more young doctors together, medical students together under the IMA banner, and then let us grow together. Thank you.
Thank you, Dr. Arian, sir. So we have our well-wishers and also our IMA officials of Tirunelveli, President Abu Bakar sir, Secretary Prabhurat sir, and Finance Secretary Kannan sir, and Emerson Coordinator Pratibha ma'am also lent their warm wishes for this THIRAN sessions, and we'll proceed with the session. Darshana, you can welcome the speakers.
Yes, ma'am. We welcome our first speaker for THIRAN Session 3, alumni of our college, Dr. Nithin Krishnan sir, 2018 batch of TVMC. He has cleared UPSC CMS exam, cleared the interview, and received postings in railway. We request you to please take over the session, sir.
A warm good evening to everyone in this session. And first of all, I would like to thank the IMA MSN Tirunelveli to give this opportunity to talk about UPSC Combined Medical Service Examination. So I and actually the other speaker have decided to split the topics to be discussed today. And so there are various phases in combined medical service examination because like how the UPSC conducts the civil service examination. Similarly, there is two phases in combined medical service examinations too. So right from the beginning, what is it? Then what are the written part? What about the personality test, the career opportunities, everything. So we will be discussing today in detail. And I have decided to discuss till the interview day, or the so-called as the examination part, which includes both the written examination as well as the personality test. So I think, ma'am, my audio is clear.
Yeah, audio is very clear.
Okay, ma'am. So, so you know that the combined medical service examination, or the so-called as the CMS examination, it is conducted by the Union Public Service Commission for the recruitment of medical officers, which are Group A post, to various government services or organization like the Central Health Service, which is what we call it as the CHS, then Indian Railways, Municipal Corporation of Delhi, and the New Delhi Municipal Council. So these are the various cadres which comes under this combined medical service examination. So next slide. Yes. So these are the two categories of doctors or officers which comes under UPSC CMS. The category 1 is actually the medical officers, grade in general duty medical officers, subcadre of Central Health Service. Yeah, that is what we call it as the CGHS, Central Government Health Schemes or Health Services. And the category 2 is the Assistant Divisional Medical Officer in the Railway, that is ADMO. And the next category, the next cadre which comes under category 2 is the General Duty Medical Officer in the New Delhi Municipal Council. And the third one is General Duty Medical Officer in Municipal Corporation of the Delhi. So these are the various cadres which comes under the UPSC Combined Medical Service Examination. And through this examination, the doctors are selected for all these posts. So this is like how we have in civil services like IAS, IPS, and so on. The same thing in UPSC CMS, they have given the mentioned cadres. So far, I hope you get an idea about what is CMS examination. Of course, it is conducted by the UPSC, the Union Public Service Commission. And so all this information which I am just discussing are completely taken out from the UPSC's official website. So you can, at any time in future, you can just go to upsc.gov.in, the website, official website of the Union Public Service Commission. And in that you will be, you can just go to the CMS option, and in that you will be able to download all the related information which I am sharing. And Sir also will be sharing all these details from the official UPSC website only. So in case in your future, you can refer the same website for further information. Next slide. Okay, So coming into what is the educational qualification you need to appear for this examination? Actually, you must have passed the written as well as the practical part of the final MBBS examination. For example, you may be doing your final year, and at the end of the final year, you'll be having your final year university examination and final year practical examination. So once you have passed the written as well as the practical part of the final MBBS examination, you are eligible to appear for the UPSC CMS examination. But there are two important things which I would like to clarify on that. For example, if you are a student who is just studying the final year MBBS, okay, you haven't completed. For example, every year the exam is usually conducted in the month of July. Okay, the second week of July. That is actually one of the tentative dates that UPSC give in their website. So during that time, most of the students will be like doing final year MBBS. You can still give this exam, but the second part, which is the so-called as the interview or the personality test. But at that time, you have to show your proof that you have passed the final year MBBS exam. So the first thing, that is the note 1, which is mentioned in the UPSC website. It always creates some confusion among the candidates. But what everybody recommend is, once you have completely passed, once you have successfully passed the written as well as the practical part of the final MBBS examination, without any issues, you can proceed with the rest of all the parts of this examination. That is the written as well as the personality test. Okay, and if you haven't you have just completed your final year MBBS, and at the same time you haven't even completed the internship, no issues. You still can you can successfully appear for the written exam, and if you clear the written exam, you can automatically go for the personality test, and you will receive the posting order only after you have submitted your internship completion certificate to the UPSC. Okay, so this is the note 1 and note 2, which is mentioned in the website. So many students used to ask like, sir, I'm studying final year MBBS. Can I appear for the exam? Once you pass your written and practical part of final MBBS examination, that is the better, that is actually the best time to give. So I have mentioned it in that slide. The best time to give is after your final year exams. For example, your final year exams will be over by the month of April, and in your May, you will be starting your internship. You can apply that. The application for this exam usually start from the month of February. You can give your application at that time, and you can successfully give this exam at the beginning of your internship. That is in the month of July. Okay, at that time only you would have just started your internship. So this is actually the best time. So next slide. Okay. And so coming into what are the parts of this UPSC CMS examination? Again, this is taken from the official brochure of the UPSC CMS examination. Okay.
Sorry for the interruption. Nithin, you can continue.
Okay, ma'am. And so the part 1 is the written examination, which is actually for 500 marks. Okay, the candidate will take the written examination in the 2 papers. Okay, each paper will have a maximum of 250 marks, and each paper will be of 2 hours duration. And first, let me clarify, unlike the NEET, PJ, INICT, and other examination, which are a computer-based test, what I don't know the reason, but UPSC has preserved their own way of the so-called as OMR sheets. Okay, it's an offline exam, and the question paper along with the OMR sheets will be given, and you have to bubble your answers, like how the way you have appeared for your NEET UG exam. And various recommendations has been made to make this exam as a computer-based test. Maybe in the future, this exam may be converted into a computer-based test too. But as of now, even in 2025, UPSC has gone with this written examination only. And so the candidate will appear the written examination in the 2 papers, and each paper, as I told, it has a maximum of 250 marks. So that is actually the part 1 or the written examination. And the tentative date of conduction of this written examination is usually in the 2nd week of July. Okay, and the application for the same will be starting by the time of February, March, April. So these are the application starts from Feb, and usually it's end by the 30th of April. So by that time, I know you will be studying your final year. You will not have got the results, but okay, if you are prepared well, and if you feel that you will definitely get into the clear the 2 parts of your final year university exam, no issues because the application fee is just 200 rupees, and you can file your application for this examination very early itself, so that once you get the results, and you can straight away appear for this examination in the month of July. And the part 2 is the personality test, which is for 100 marks. Okay. And this is only for those candidates who have qualified the written examination. For example, the written examination is in the July. Within maximum 1 month time frame, UPSC declares the result of written examination. But again, the time frame varies from year to year. Sometimes they may take up to 2 months to declare the results. And once they declare they will just release so-called as the list of qualified candidates. Okay, just the roll numbers of the qualified candidates who have scored above the cutoff marks in the written examination, and the cutoff marks, that is beyond how much marks is the so-called as the passing marks. It is decided by the UPSC completely, and it completely depends upon the number of vacancies every year. Okay, for example, when the time I was appearing, there were more vacancies, that is around 1,300 vacancies were there. And at that time, the cutoff will be a bit low. And in other years, when the vacancies are low, of course, they will rise the cutoff. So the value is not fixed, and it changes from year to year. And second is a personality test. It is for those who qualify the results of written examination. Okay, then let me tell actually what does this written examination includes. Because for NEET PG or INICT examination, like all the 19 subjects will be asked in the form of 200 questions, and where you have to attempt the 200 questions within 3 or 3.5 hours. But unlike that, there is actually a slight difference in the pattern of UPSC CMS examination, because UPSC CMS examination mainly focus on our final year subjects along with community medicine. So the paper 1, which is of 250 mark, it is actually including only general medicine and pediatrics. Okay, totally 120 questions, 96 from general medicine and 24 from pediatrics. The so-called as general medicine, it is not just only general medicine. Every year UPSC asks questions from psychiatry, dermatology, and that is other general medicine related subjects. So I don't think that it's just only general medicine. Psychiatry, dermatology related questions are also asked in that 96 questions, and 24 questions from pediatrics. Okay, and that is actually the total 120 questions in paper 1. And that is the forenoon session. Morning, you will be appearing for this exam, usually like 10 to 12. And afternoon, you will go for the second paper. And as you can see in this image, the paper 2, again, 250 marks, totally again 120 questions, 40 questions each from surgery, obstetrics and gynecology, preventive and social medicine. That means, as such, there won't be any questions from anatomy, physiology, biochemistry, pharm, path, micro, forensic medicine, okay, ophthalm and ENT. But these years, the UPSC has started asking integrated questions. Integrated questions in the sense, some pharmacology, some drug-related questions, adverse drug reaction, some pathology integrated with surgery, like that. But straight questions from these subjects has not been included so far in the UPSC CMS. So that's what I told you. Unlike the other competitive exam, UPSC CMS mainly focus on the community medicine as well as the final year subjects. So that means if you are damn good in the final year subjects, if you're a final year MBBS studying student, and if you are focusing well on your final year subjects, definitely you can get a wonderful score in your first attempt. Next slide. So yeah, how to prepare for the exam? Most of the students maybe like they will start preparing for the competitive exams like NEET PG and all from the final year itself. And if you are such a student, definitely the preparation for UPSC CMS, seems to be very easy, because already all these subjects you have to study in detail, in depth for your UPSC, NEET PG. So the same will be helpful for your UPSC CMS exam also. But the one thing that differs in the UPSC CMS is the pattern of questions. Okay, there will be a lot of statements. They will be giving some 4 to 5 statements. And they will ask you how many of these statements are true, how many are false. It's not just like a straightforward question. It's like an analytical and a logical thinking based questions. Okay, and so it is always advised to see the previous year questions to understand the pattern, because in NEET PG and all, there is a different pattern. In INICT, there is a pattern different. Like that in UPSC CMS, they have their own pattern of asking questions. So in-depth knowledge on the previous year topics is actually needed. Okay, for answering the questions in UPSC CMS. And once if you are good at the previous year topics, many questions you will be getting straight from that only. So it is always advised to see last 10 to 15 years of the UPSC CMS previous year questions. All the question papers along with the answer keys are available in the upsc.gov.in official website. Okay, there is no need that because within 1 to 2 months of the UPSC CMS exam, UPSC itself will release the question paper along with the answer key in a PDF format, and it will be uploaded in the website also. So you will get all the question paper with answer keys for the same. So if you are good at medicine, surgery, obs and gynae, pediatrics, PSM, and I told you surgery and related subject, that is orthopedics, anesthesia, derm, psychiatry, the number of questions are less only from the short subjects like anesthesia, psychiatry, and dermatology. But every year they used to ask like 2 to 3 questions. So make sure that you are reading those subjects also well. So overall, if you are good at final year subjects, and you can definitely do this preparation while solving, you can solve all the UPSC CMS previous year questions side by side. And by the end of final year, you automatically gain confidence in all these subjects. You can register for your exam, and by the beginning of your internship, you can make your first attempt. So that finishes the so-called as the written part of this examination. Let us go for those candidates, and after within a period of 1 month, the UPSC will release the results, and they will release the number of qualified candidates of the written examination. And those qualified candidates will be asked to file something called as DAF, that is detailed application form. Okay, that is actually exclusively for those candidates who are qualified the written examination. And based on in the detailed application form, it's like how you file an application for a job. Okay, your hobbies, your personal information. Okay, how far you have, what's the which college you are, what's your native, everything. Okay, and that everything you have to file it in the online website, and it will be submitted, and the UPSC will release the interview dates. Okay, and the interview is the so-called as the personality test, which is the second part of this examination, and which accounts for 100 marks. So 500 plus 100, 600, and the final result will be usually released in the month of November or December. That is for total of 600 marks. And the UPSC also have a cutoff out of 600, how much you must score. So that based on the number of vacancies which are released every year, you can commit the so-called as the final merit list, which will be released in the month of December, usually after both all the interviews are done. Okay, so let us discuss about the interview day. Next slide. Yes, so this is the final part of my discussion, and so this is actually one of the question that many students ask me, sir, how strict is the interview? Like, is it like the interview of the UPSC civil service examination? Of course, no, it's definitely not. Okay, it's not like how the UPSC civil service examination interview. It is a bit, I will say, more comfortable and an easier one. But what most of the students think is that it will be in the interview, they will be just asking our medical science related questions, but that's not actually how it goes, because the panel of interview board includes an IAS officer, a surgeon, a physician, physician, a pediatrician, sometimes ortho. There are lots of interview boards in the UPSC, and the members change. Some interview board, for example, when I was going for the interview, there was an orthopedician. When my friend was going, there was an OGIan. So it varies, but minimum 3 to 4 it will be there. And of course, there will be an IAS officer for sure. So the one thing what I want to tell about interview is that it's not just an exam or a personality test where your knowledge about a subject is asked, assessed. Okay, it will also ask, it's a test for your personality too. So that's what I want to make you clear. Okay, it's a test for your personality, your decision-making ability. For example, they will ask a very simple question. Okay, you are working in a primary health center. You are working in a low resource setup. A patient comes with postpartum hemorrhage. How will you manage? Okay, so those questions look so silly, but they just test our practical knowledge. Okay, theory knowledge, of course, questions are asked, but more of the kind, it's like the practical questions they are asked. And what is the duration of the interview? It actually varies. For me, it was just only 10 minutes. For some, it will be 15 minutes. It varies based on the interview board. Okay, and of course, we have to make a proper dress. We have to maintain a proper dress code, and which is mentioned well in the website of UPSC. And once you submit your DAF, you will be intimidated about the same. And what when I appeared for the interview while I was doing my internship, and so they asked many questions regarding how I have been doing internship, what are the departments where I finished my internship, okay, and what was my experience. So many questions, and they will ask, of course, the IAS officer will ask a lot of personal questions, okay, because in the detailed application form you will be filing your hobbies and everything. So they may ask about your hobbies, your native place, what are the tourist attractions, some basic questions, okay, that and all each one of us can manage well. And of course, then coming to the theory questions or the subject related questions, and along with the practical questions. So altogether, it may last for minimum or maximum of like 15 to 20 minutes, not beyond that, I think. And you can manage that day well, okay? And so that's about the interview. So once you have done your written exam, you will be called for interview. Before that, you have to file your DAF. And once that is done, UPSC will release the final merit list, okay? And of all the candidates who have successfully cleared the written as well as the personality test, your gross marks are also released by the UPSC. Out of 500, what was your written marks, and out of 100, what was your personality test mark, your total marks, everything, your rank, okay, your category wise, because I told you there are two categories, category 1 and category 2, okay. You can select your own preferences while submitting the DAF, okay, which you need category 1 or category 2, and based on that, UPSC will release a combined merit list, category 1 list, category 2 list, then scorecard, everything separate. Okay, and I think with that, I have come to the end of my discussion about what is UPSC CMS and what about the examination, the written part, the personality test, the when to prepare, what is the ideal time to give this exam, and everything. And next, Siva will be discussing about the post results, the opportunities, and so
on. Thank you, sir. That was such an informative session on UPSC CMS examination. You had highlighted on the cadres, the education qualification that is required for the examination, the mode and the pattern of the examination, and how to prepare for the exam. Thank you, sir. So now we welcome our next speaker of our session, THIRAN. Dr. Siva, sir, we welcome you. Sir is a college's alumni of the 2016 batch of Tirunelveli Medical College. Sir is working under the central government health scheme under Ministry of Health and Welfare as a medical officer in CGHS Chennai. We are happy to have you, sir. Kindly take over the session, sir.
I hope I am audible to each and everyone. I am audible, Dr. Srija?
Yes, sir, you are audible, sir.
My audio and video is clear?
Yes, sir. Audio is clear and video is
Audio clear, sir.
Yeah, thanks. Yeah, it's a pleasure to be here with you all today. Myself, Dr. Siva. I'm from Tirunelveli Medical College, 2016 batch. Currently, working in a central government health scheme, Chennai, under Ministry of Health and Family Welfare. I cracked UPSC CMS 2021. I got All India rank of 45. And before starting this session, I would like to thank this IMA MSN officials and Dr. Srija and also Dr. Nithin for his wonderful presentation. Yeah, I'm going to give a gist about the UPSC CMS examination. So when I was preparing for a UPSC CMS examination, at the time nobody knew what is UPSC CMS exam. But now scenario is changed. When you open the YouTube and search UPSC CMS, many UPSC selected candidates, they are uploading videos regarding interview and that cadre and like so. This exam is now more familiar or famous nowadays. So Let's start with UPSC CMS medicals. The first line. Yeah. So before that, then in UPSC CMS, that planning is more important than preparation, because you are going to Delhi. Okay, where that you are going to attend that interview and medicals. So that interview is very important, because that only will determine the place of posting. So if suppose you are performing well in interview now, you can get a chance. You can get a higher chance of can get a higher chance. Like you can maybe posted near south side. So that the interview is very important. So before that, that planning. So planning involves two. One is travel plan, and another one is that accommodation plan. Why? Because you are going to Delhi mostly between July to October. In Delhi, July to October is monsoon season. So our preferred mode of travel is through air travel only. So you have to because at the time, because of that monsoon, say the last minute they will cancel the flight. Suppose you have booked one ticket one day before your interview now. At the time, heavy rain in Delhi now, you are not able to attend the interview. So one day prior, you have to book your ticket. So that so the planning is very important. So you have to book your ticket one day prior, okay, before interview. Then in this picture in Delhi, we are having two houses. The first one is Vaihai. Then another one is Podihai. These are all our Tamil Nadu house. Okay. Usually, they are these two houses. They are under our Tamil Nadu government. They are giving good accommodation for that UPSC aspirants. So they are mostly that in Delhi, these two houses situated within 5 kilometers, because your UPSC in UPSC that interview in UPSC Bhavan, these two houses, they are situated within 5 kilometer radius. So if you plan stay in if you plan to stay in Podihai or Vaihai, it will be a correct thing. So you can reach the UPSC Bhavan on correct time. So suppose at the time is heavy rain now, you can't suppose you are taken you are staying far away from the from UPSC Bhavan now. At the time it is very difficult to reach the UPSC Bhavan. So always plan your travel and plan your accommodation. Yeah, that this through online, there is one portal is available. Tamil Nadu House, Delhi Tamil Nadu House. There is one online portal is available through which you can book that rooms. Then next slide. Yeah. So now your interview is over. Interview over. The immediately next working day is your medicals. So your medicals usually at the end of the interview they will give one list. So we have to choose any one of this hospital. So usually they will give a list of 5 hospitals. These 3 are very big hospitals. Also they are situated very nearby. Very nearby also. From Tamil Nadu, these are all very nearby. So the first one is Safdarjung Hospital. As that Safdarjung Hospital, this is the hospital with the largest OPD in India. So it's such a huge hospital. Then another one is Ram Manohar Lokia, and another one is Lady Heartage. So why we have to? What is the importance of knowing these hospitals now? So most of them will prefer this Safdarjung Hospital, because they are within mostly within same day they will finish all the exam, all the your ENT, eye, then general surgery, general medicine, and every exam. So the problem is those who are wearing power glasses. So in rest of the these two hospitals, that same day itself they will dilate and give their opinion. But in subdurgen, they won't dilate in a same day. What they will do, they will give you a date, which is I think 1 or 2 months. After that, they will give one date. They ask that person to come again to Delhi for their eye examination. So it is not possible to visit again. So those who are wearing specs, be careful. So don't choose subsurgeon hospital. You can choose Ramanogologia or Lady Herring. That will be very useful because you no need to come again. Okay, so they are there. They will dilate on same day itself. Okay, first the rest of the cases, those not wearing, those not having any power glasses, no, but very well you can go to subsurgeon hospital. You can choose subsurgeon hospital. But with peoples with some high power, like some high myopia and all, better choose rest of these Lady Hardage or Ramanogologia. Okay. Next slide. Yeah. During your medicals, as I said earlier, the next working day. Okay, the next working day is your medicals. So for that, some prerequisites are there. So first one is fasting. You have to reach. You have to be in minimum 8 hours of fasting. So also you have to produce your recent glass prescription. Okay. So also always you have to keep your glass prescription with you. Then it may take it may that medical test that, for people sometimes. They will do some special test, so it take up to 4 o'clock. So don't book any flight ticket at 3 o'clock or 3:30 or 4 o'clock. Okay. Then Saturday and Sunday is holiday. Why this is important? Some usually from Monday to Friday. Those who are having Friday interview will have medicals on Monday. So you have to stay Saturday and Sunday in Delhi. So first you have to, after once you get a list that interview date, you have at the time first you have to see whether which day your medical is there. And then suppose if you are medically in Friday, you have to be ready for your extra accommodation. Okay. Next. Yeah. In medicals, mostly they will take ECG, urine routine, random sugar, and chest X-ray. Okay. So mostly then same day itself they will give you a report, and they will, at the end of the day they will certify that you are fit or unfit. So they will send that same day itself. They will send all the medical reports to UPSC. Next. Yeah. So now your interview is over. Now your medical is over. After that, they will release one list. And in that list, they will use one word, that is provisional. Now you are finished both the theory, interview, and medicals, but you are still in provisional. Because why? Because mostly they will ask all original certificates. So now I'm currently doing now I'm in internship, so I don't have any that degree certificate, because after that only we in Tamil Nadu mostly we will get after 6 or 8 months only we will get that degree certificate. So they will put they will write like degree certificate is pending, so you are in provisional. So mostly they most of the candidates in provisional only. So always I will keep all your original documents with you. If you suppose any error in that original, na, they will simply write provisional. So you have they will give time. So before that you have to clear that provisional status. Then only they will issue appointment. So the somebody have some name discrepancies, like yeah, based on that UPSC knew that Shiva B and B Shiva both are different persons. So always try to always produce a certificate where everything is in a correct form. Like Shiva B, everywhere it is will be Shiva B only. So if it's somewhere in the certificate, it will be written like B-Shivana, they will don't accept. So always you check all the things, and before going for interview, at the you'll bring make all this correction, and all their produce correct certificates. Okay, so they after that if you anything is if you write a provisional your appointment may be get delayed. So always prepare before that, before applying for UPSC examination, make sure that you every in your every records your name and date of birth and everything is correct. Okay, next. Yeah, this is now this your interview and medicals are over. Now that results also are announced. Now your name is not in provisional list. So the next thing is cadre allocation. Okay, 1 minute. Yeah, next thing is I don't know, previous one. The previous one. Okay. So after results, they will allow. So now you are selected. Okay. Now they will see the your DAF. So as Nithin, Dr. Nithin said, the DAF is very important, because in the DAF they have asked one question like which category you want. We are having two categories: category 1, category 2. So most of them will not remember which category they have given earlier. So they will record all the things. So then they will, based on your previous DAF. Okay. Yeah, the previous one. Okay. So the so always keep in mind. So DAF is more important. Why? Because you can't change the DAF once it was submitted. So now you got a good rank, but mistakenly you have in the DAF you are selected railway now. You can't change hereafter. Okay, so always fill the DAF with caution. So now based on your marks, they will now the UPSC send all your medical and your all your details to the concerned ministry. The ministry will release this cadre allocation. So in the cadre allocation, mostly they will they will tell Siva, you are going CGHS, Dr. Nithin Krishnan, railways, like that. They will allot the cadre. Okay. Now the cadre also allotted. Then our file is now submitted to concerned department. From there, they will issue appointment order. So once you get an appointment order, you have to report where that you report in the particular zone. Then they will give the one order. That order only will tell where you are posted. So before that, nobody knows where you are going to post. Okay. Next slide. Yeah, usually this is that cadre allocation PDF that you go tell. They were in that you can see that Union Public Service Commission has recommended forwarded choices of 600 candidates of category 2. Who are like that category 2 means that railways. Okay, railways and that municipal corporation Delhi. So this is for category 2. Category 1 also they will separately they will release. And next one. Yeah, this is the appointment order. In that they will clearly mention which batch you are, which post you are selected, and your rank and all. Like here you can see that that is category 1. So your category 1 you are posted in CGHS. Okay, next. Yeah. Yeah, this is yeah. But suppose okay. Now we are having two options. The one person is selected for CGHS. One person is for railways. In CGHS, you will be appointed as a general duty medical officer. In railways, you will be posted as assistant divisional medical officer, ADMO. Here it is GDMO. Okay. Then place of posting. Suppose we are selected in category 1, they will posted you in this wellness center. Okay, this is wellness center. This wellness center is like our PHCs. Will be mostly we will deal with all OPD and your any first aid and emergency. These three. Okay. Also, we will refer the patient for any the patient requiring any higher treatment. We will refer to concerned government or our empanel hospitals. So this is we are posted in category 1. You will be posted in if we are posted in wellness center. Suppose category 2 people will be posted in can be posted in 3 different areas. In the railways, we are having like our state health system. They are also having we are in state we are having PHC, CHC, medical college. In railways also they are having health unit, divisional hospital, and tertiary care hospital. So maybe they may post you in peripheral unit or in divisional hospital. Okay. So, but here in category 1 only they will post you in dispensary. This dispensary in Tamil Nadu, it is available in all 3 cities. As we all know, the based on cities, the government divided the cities into X class city, Y class city, Z class city. In Tamil Nadu, the Tirunelveli is Z class city, Coimbatore and Trichy is Y class city, and Chennai is X class city. This CGH is available in all 3 cities in Tamil Nadu. Okay. Next slide. Yeah. This is if you are posted in category 1, your posting is general duty medical officer. Your main thing is OPD consultation, diagnosis, treatment, which also here this in central in category 1 and category both categories, you are not only having your clinical work, you are also having administrative work. So you have to do that administration work also. You have to coordinate other departments and you have to do administrative work also. So we are our work is not only a clinical work. We are also we have to do administration work. So like assisting any empanelment of hospitals and chemists, processing of bills. So in category 1 CGHS, usually CGHS is it is functioning as a like PHC. Also, it is a referring unit. Also, it deal with all the like it's a insurance also. So like we are giving insurance to all the currently we are having around 50 lakhs beneficiaries throughout India. We are having 50 lakhs beneficiaries. The beneficiaries are currently working or retired from government of India. We are giving insurance. Okay, insurance for them. They will take treatment and later they will submit bill also. So we have to see that bill also. Okay. Next. Yeah, this is regarding posting in category 1. Initially, you are posted as GDMO. Then you will be posted to senior medical officer. After that, you have to will be promoted to chief medical officer. From the chief medical officer, you will be posted to superintendent administrative. And thing is, during every promotion, your pay will be revised. You will get a higher pay. Okay, till from in category 1 CGHS, you can reach up to the level of additional secretary level. Okay, because if you are posted in medical officer now, you can reach up to the level of the additional secretary. Okay, additional secretary, government of India. Okay, yeah. Next. Yeah, usually regarding our we are currently we are around 2,300 posts GDMOs currently sanctioned posts in India. So mostly all most of the vacancies are filled. So but every year that new posts also create. The government is creating new posts also. So every year you can get a chance. Every year around 200 new posts they are creating. So you get a future scope also. Future also they will create new posts. Okay. and this is like these are all like insurance. Like as I said earlier, we are also doing some insurance work also. We are giving the like settlement also. Last year around we have 6,325 crores we have settled also. Next. Yeah. This is this was yesterday's breaking news that the 8th pay commission was update that cabinet approves terms of reference panel to make recommendation within 18 months. Suppose if I will tell at the end of the slide, I will tell the importance of this 8th pay commission. Next. Next slide. Yeah, and this is the annual calendar of UPSC 2026. Okay, every year the UPSC will release this calendar. Okay, this is for next year. Next year, you can see that combined medical service examination will be conducted in 2/8/26. Okay, 1 minute. Yeah. This is in the next year the exam will be next year this exam will be conducted in around 2/8/26. So mostly they will we so those who want to prepare for a UPSC CMS. So then as Subramanian sir said earlier, so NEET PG is a foundation. So there is no separate preparation for UPSC CMS. So always prepare for your NEET PG. Meanwhile, you can attend this exam. Okay. So next year around 2/8/26 there will be exam. That's UPSC CMS exam. So suppose if you are writing this exam now, mostly 2027 March you will be posted as you will get an appointment letter. So at the time you have got your appointment letter. So you joined duty now. Within 1 year you will get a new pay commission. The previous slide. Yeah, you will get a pay based on your 8th pay commission. So that future aspirant, that future medical officers in central health service, they are lucky because within 1 year after the joining, yeah, they will get a new pay. New pay means they will get a good pay. Yeah, next. Next. Yeah. So at the end of the slide, I hope all of you enjoyed this session. So winners are not those who never fail, but those who never quit. So regarding future scope, so the government usually every year around 1 lakh crores. Usually our union health budget is around 1 lakh crores. So they are so the government is spending around 1 lakh crores every year. So then so CGHS is directly under the Ministry of Health and Family Welfare. So there is no future if you choose this partner, there will no need in future. You will be future is like safe and secure. So main thing is, so first thing you will have to decide whether you have to go for PG or service. Because the government is mainly that this CGHS is mainly meant for that after MBBS only. But now they are also expanding. Now they are expanding for another super specialty branches also. They are in future they will expand. So mostly you will get a chance for a PG in future only. Now at present you are mostly if you are posted in central health service, you will be in with the MBBS degree. You will be giving you have to. Mostly you have to suppose if you are having with your suppose you are having ortho PG now PG also, you have to do same MBBS work only. But future maybe it can be expanded. At the time you can get a chance to practice your ortho related all clinicals. So as of now, only up to the MBBS level only they are having all the facilities. So future you can get a chance. Okay. Thank you.
Thank you, sir. Thank you so much for your clear guidance on the examination and how to proceed until we are employed, sir. So I think we'll have certain doubts and we will get it cleared from you. So the first doubt is, sir, like, how do we go on with post-graduation after UPSC CMS? So what are the pros and cons? Are there any reserve seats for medical officers working under this, and how does this work?
Yeah, definitely. Definitely, we are having once you complete 5 years of service, you are having a separate reservation in INICT. That is, in a central institute, you are having one separate reservation. Is that you can use that reservation.
Sir, compulsorily, we'll be having to work for the next 5 years. So the bond is for 5 years.
Yes, but there's no such bond. So if you want a PG, you have to you have to you have to give, I think, a minimum 5 years of service. Okay, before that they won't allow you to pursue PG. Mostly you have to serve 5 years, then you can get a PG.
Sir, and what about the bond associated? I mean, what about the private practices? So can we practice outside, like how medical officers do in state MRB examinations and all? So can we do our private examinations? I mean, private practice and also.
Yeah. As of now, it is no private practice is allowed because government is giving non-practicing allowance. Okay, so they are giving amount for not practicing. So suppose in future if they remove that non-practicing allowance, at the time we can also practice. But now as of now, no private practice.
Okay, sir. And what about like how can we work in our own hometowns? So what's the procedure to get allocated accordingly? So if we get posted in a distant state in the first interview, and then like how do we reallocate to our hometowns? Or how long will it take? And what are the procedures?
Usually every year they will conduct transfer committee twice. So if you are suppose if you are posted in Delhi, after it may depends upon the vacancy. So later definitely there will be a chance that you can get posted in near your hometown. But you have to be purely vacancy based. But chance is there. But chance is there. You can get you can get your hometown later, but that years we can't tell correctly. But if there is vacancy within 3 or 4 years, you can get a hometown.
Okay, sir. And a student who is participating in the meeting is asking a few questions, sir. So asking, will we be posted all over India, sir? Like all the states, like there's no restriction to it.
Yeah, there is no such restriction because this is all India service. So they may be posting in Kashmir also. They may post you in Tirunelveli also. So but all are based on your merit list. So if you are having good marks, you can get easily you can get your hometown. Okay. Also, we are having so many other institutes also. Like in Tamil Nadu also, we are having Indi, we are having BCG Institute. In Chengalpattu, we are having Leprosy Research Institute. Like in Kunnur, we are having Pasture Institute. Like that, other option also there. So you can apply for when you are applying for transfer, you can get this institute also. So transfer is every year twice they will conduct. So you can use that chance. You can get a hometown. Right?
Sir, and about the reservation, like how it is in NEET PG, the central examination reservation, is it the same here also, sir? The reservation applies here also.
Mostly they will allow mostly they in central institutes only they will they the central institutes only that the reservation is now available, but you can write NEET PG. You can through NEET PG you can join PG also, but they won't allow any bond. Only up to 3 years only they will give leave, but automatically the central institute they are not having any bond. So that's why they are giving reservation only in central institutes.
And are there any participants who want to ask questions to either of the speakers? please post it in the chat box.
1 minute. Yeah. Any questions?
Yes, sir. So there's a question. So is our promotion based on our educational qualification, that is PG, or it is based on experience and our performances? So how does the promotion work, sir, after we get into it?
Yeah, mostly that promotion is based on your duration of service only. I automatically once your 4 years of service completed, then you will be promoted to senior medical officer. But here, what be the thing now? That promotion will not tell if you are promoted, you will get a new power. Not like that. You same, it is the same wellness center, same place, same seat only, but only your pay only will be replaced. So after that, we are having fixed years, the fixed chart. Once you completed that period, now you will be automatically will be promoted.
Participants, are there any other questions left for you to ask? You can post it in the chat box. Yes, sir. I think we are done for today's session. So I'd like to call Dr. Thank you so much. Thank you so much. It was such an amazing session. We got a clear
Okay,
picture of how to start and how
okay,
to go
Krishnan,
to.
actually, I want to.
Yeah.
Yes.
Okay, personally, I wanted to thank both the speakers, and one of them, Siva sir, is my immediate senior, and Nithin is my immediate junior. And it was short, and I think the last week only I asked them, can you both give us a session on UPSC CMS? And I know both of them were working. Nithin Aspa. I have met Shiva sir personally at CGH Center for my father, who was working in central government. So that place itself was well and they were seeing patients. If it was 50 or 60 a day, they're chilling out and seeing everyone without any complaints, and that was a very nice place to work also. And my father also used to say, you should pass this exam and become like Shiva sir. So I'm personally thanking Shiva sir and Nithin for coming for this session, and it was very informative indeed. Because many of the things even I didn't know. I have written the exam 2 times, and unfortunately I have not passed, and I know why now. Because what and all tips I have to take in and give for the next exam, and I'll take it. And thank you. And every minute of the session was very useful, and everything was entirely covered by Nitin and Shiva sir. So thank you both the speakers, and I'll invite Nandini, our convener of IMA MSN, Tirunelveli, to deliver the vote of thanks. Nandini, you're there? Okay, I think there's a connectivity issue. Okay. This was a wonderful session overall. And regarding UPSC CMS, we have learned so much things from our two speakers, Dr. Shiva He is working in CGHS currently. It's been his 4th year working. And Dr. Nithin, who has completed UPSC CMS and who was selected for railways. We thank both the speakers on behalf of IMA MS and Tirunelveli. And thank you for coming for this session by our warm invites. And this was indeed a wonderful session. And we thank all the participants, and also we thank the organizers of MS and Tirunelveli for conducting a wonderful event. And I thank moderators Kritik Roshan, our finance secretary, and also Darshana, co-convener of IMS and Tirunelveli. And it was yet another wonderful session of Tiran. So more sessions to come by. And I'm glad to announce our 4th session, which will be on next upcoming Wednesday, November 5th on TNMRB. It is yet another exam of medical field after MBBS. So we'll be having it soon in the next week. So we thank all the participants and speakers for this wonderful session. Without you all, there would not have been a perfect session like this. And I also thank all the IMA officials of Tirunelveli. I also thank our mentors, Dr. Subramanian sir and Dr. Hariharan sir. Thank you, everyone. We'll be closing this session. Thank you. Darshana, we can close. Thank you, everyone. Thank you.